think with the advent of the City Dementia Outreach Team, for the first time, patients in care homes became a priority. Prior to that, caseloads had been so big that people in care homes were often not seen as being at risk. So with the Dementia Outreach Team, we are their dedicated team, if you like.
Within the Dementia Outreach Team, which is a unique team providing specialist care to people with dementia in care home settings, the quality that they get is as good as, if not better than, people in the community.
So the referral's normally straightforward. We tend to go through GP for new referrals, or if they've been referred before, we would go straight back to them. We know the process that we go through to make sure that we're doing things the right way that can help that resident, really.
When we arrive at a care home, we engage very much with the care staff. They are delivering the direct care to the patient we've been asked to see, and they're usually the most valuable source of information.
And we're there to support the professionals, the OTs, the nurses, the physios, in their treatment plans for the residents that we go to support in nursing and residential homes.
The team visit on a regular basis and linking to the residents that need the support. I think the Dementia Outreach Team work hand in glove with us, and like an extended arm of the home, essentially, part of that team.
A lot of the time, the long-term memories are intact. So, and if we can work with somebody and help them to access those memories and the positive feelings that go with those memories, that's really helping their well-being.
Occupational therapy is always about trying to help people to do things they either want to be able to do or need to be able to do. The benefit of occupational therapy is about looking at the environments that people are in, and that's really important in a care home setting because it's the physical environment but also the social environment of the staff. So the occupational therapists are really key in trying to understand how that relates to somebody's behaviour and their presentation, and how to present care activities so that people are more likely to be as compliant as possible and accept the care that they need.
So we will hold forums that we invite the activity coordinators to. A lot of homes will have activity coordinators, not all, but there are. I think that is a role that's being recognised as really important.
About 12 months ago, we'd identified that patients who were appropriate for cognitive stimulation therapy, if they lived in a care home, that they weren't able to access that through the normal route.
Yeah, it's been really beneficial for the residents. They've really enjoyed coming into the sessions. We bring in yo-yos and skipping ropes. We had old coins in, threepence, and the old notes as well. Also card games and cards with pictures on and names on the back, which really helped them.
I do an assessment on the patient and find out what their ability is and try and maximise their independence to keep them as mobile and independent as possible. So for the past 7 months, this gentleman hasn't been able to stand. He's been transferred with a full body hoist and the care staff have been using a wheelchair at all time. I went in to see him last week and he stood up and mobilised about 5 metres with me.
I mean, it's just nice to see him, just that little bit of movement after having none for so long. Kimberly's just, I don't know, she just seems to know how to talk to Dad and get the best out of him. So yeah, she's been brilliant.
We try and make contact with families if possible because they're a great source of knowledge. So we're able to talk to them and maybe get a bit of that person's life history.
The support came at a time when we were desperately in need. The journey that Mum and I have taken together through dementia has been an emotional roller coaster. Well, I can't say enough about the help and support and the difference that they've made during that 3 years. It's been absolutely wonderful. Made a huge difference to both of us. Her dementia has progressed. There's no doubt about that. And we continue to have very, very difficult days. But when Mum's good, she's very, very good. And I know that the work that Debbie's done has made the difference.
It can just be somebody responding to your touch or somebody smiling or somebody just giving you a hug. But just seeing that well-being and that you've made a difference to somebody makes me want to do my job every day.